Syndosmology, arthrology is the study of articulation, 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 commonly called joint. The joint, the articulation is formed by the union of two or more bones or cartilage, or both of the cartilage. Bones are the fundamental of the joints. Bones are the fundamental of the joints. Bones are the fundamental of the joints. The joints are made when the two bones or two cartilage or cartilage or bone joined. Anatomically, we classify the joint anatomically and physiologically. Anatomically, we see the we see the according to the mode of development, how the like we see how it's develop, like how it's develop, how it's develop, where is it present, what's its work and nature of genetic medium. Is it uniting with the fiber cartilage, or what it's uniting, and then we see the form of the surface of form of the surface of joint, how it's look like, and because they have different forms, and they have different forms and different forms, so they can fit properly where they have to. Type of joint according to classification: we have sinoarthrodeus, we have diarthrodeus, we have amphiarthrosis, sinoarthrosis. These are these are immovable joint, not moving joint. The joint cannot move. They have non-synovial fluid. Most of them are not permanent joint, but some of them are permanent joint. Basically, these are present in cervical vertebrae. Not not cervical vertebrae, like you can say. Some of them are present in cervical. They are present in different places. They are present in the medial segment of the body too. Okay, so their uniting medium is fibrous cartilage, fibrous tissue and cartilage. Classification: we have suture, we have suture, 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 suture. Classification: sinoarthrodia divided into 5 types. Suture: first type is suture. This term is applied to the joint between the skull, joint between joint in the skull between the adjacent bone, united by fibrous tissue called suture ligament. Suture ligament is further divided into 5 types. First type: suture serratus. Suture serratus, these joints are irregularly these sutural serrata, these joints are irregularly interlocked with each other. We have the frontal suture, then we have suture squamous. These joints are beveled, overlap. These joints are beveled over, like on each other, like it can be on upside or downside. It's are on each other, beveled on each other, each other. Like we have temporal zygomous suture, then we have suture harmonia. Suture harmonia, these joints are played or they are rough from the edge. We have a nasal suture. Then we have synodesmosius, synodesmosius, synodesmosius. These synodesmosius. The joints are held together by a white fibrous, elastic tissue. For example, uniting of shaft of metacarpals and costal cervicals, like the present in like the costal cervicals. Then we have synochondria. These are united together by a white fibrous, the costal chondria, sign chondrius, chondri, sign chondrius. These are united together by a hyaline cartilage. These are united together by a hyaline cartilage. For example, joint between the bezel The basal section of of occipital and septum. The basal part of occipital and septum. Semiphyseous few part of these are semiphyses. These are the few join in medial line or in medial area of body, which join together the mirror, which join together here, like I write here, the semiphyses, they join together the uh, uh, which is symmetrical portion of the body, like semiphyses, pubis, semiphyses, mandibulae. Then we have gomophyses. These are the implantation of teeth into alveoli, the sockets. Some scientists don't declare them as joints because teeth are not the part of skeleton. Then physiologically, I forgot to say something. Physiologically, we see if if the uh, physiologically we see the regard, we see as the regard of movement, a kind of movement, and the joint. And then we see the motility, we see regarded to the motility, like how fast or it can move. Okay. Then we have diarthrosis. They are proper joint, synovial joint. They are proper joint, synovial joint, or we can say the normal joints. These joints are characterized by the by the peritenoid cavity. These by the joint cavity with synovial membrane and joint capsule, and then by the motility, how much they can move. Structure of synovial fluid, synovial joint structure of synovial joint, articular surface, articular cartilage, articular surface, articular cartilage, um, articular or joint cavity capsule, ligament, and margin ring, articular. First of all, like I say here, articular surface, it is it is smooth. It is a smooth, it's in most of in most of them, it's a smooth surface, varies in form. And it's the articular surface is mostly made up of special compact bone. A special compact bone varies in histology, varies in, because on different joints it's a different bone, so it's about histology but not anatomy. It's varied in histology. Cavity, uh, like and if they get with the non-articular cavity, if the non-articular cavity interrupt, they are called synovial fossa. Like when the granules or something come in touch with and make the holes, they are called synovial fossa. Articular cartilage, it's made up of hyaline. It's non-vesicular, it's avesicular. It's get the blood from diffusion. It's a live bone. It's bluish tinge when it's fresh. It's red when it's old. Help in diminishing the dimension the effect of concision, CONCUSSION, concision. And its thickness is more in the area where it have more where it have to face more resistance, more pressure. In more pressure, articular joint capsule, simple tube, ends attached to the articular surfaces. deep deep synovial membrane. It's a membrane which produce synovial fluid, synova. It's a lubricant like fluid which work as cushioning, so the bones don't do friction between, so that friction don't produce between the joint. Then the synovial membrane increase the area by folds called by the fold called PIC, picus segment, and called the plica synovial, plica synovial. And the villi of the, and they it's have little projection called the villi. It's too much microscopic in healthy joints, so you cannot see it, but they have the cushioning pads, so which help in the cushioning of the joint, and the outer superficial layer is the fibrous septa. fibrous layer, which covered the covered the synovial membrane. Then ligament, it have a white fibrous tissue, which fibrous tissue which is known as elastic, but only one tissue in the body is elastic. It's called ligamentum nochae, and UTCHE nochae. It's present in the neck of the animal, and it's only stretchable ligaments, like you can say elastic ligament, meniscus. It's a disc between the joints, which help in the proper movement of the joint. It's present between the temporal joint. It's also present between the staphylal joint and temporal joint, and it help in the proper movement of the joint. Then we have marginal ring. It's a fibrous ring present at the articular present at the present which is meniscal ring. It's a fibrous ring which 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 is cranial one, which enclose the articular ring and prevent it from fracturing. Type of diarthrosis, type of movement: gliding, rotation. Then we have gliding, rotation, flexor, extensor, flexor and extensor, abductive, and circumductive. What is gliding? Gliding is the gliding movement, sliding movement of a joint is called gliding. Like we have like gliding movement is shown by the cervical vertebrae. Then we have flexor, flexor, like the flexor is the flexor is like we close our arm. It's called flexor. Like the elbow joint, movement of elbow joint inward, the flexing. And then we extensor, the outward movement, like we open our arm, opening of elbow, opening of knee joint. Then we have abduction of it's a some. Then we have abduction mean moving. uh, Adduction mean moving toward the joint. Like I take my arm close to my stomach, so it's like moving toward the medial joint. So adduction, moving away from the medial joint, like I'm away, like up. So now it's abduction, away from medial point. Adduction, close to medial point. Then we have circumduction. It doesn't include gliding, but it include adduction, abduction, flexor and extensor movement. Like it include our maxillary movements all. And then we have rotationally, like it's rotate, like ball and socket, like our arms properly rotate. Then we have four kind of joint: arthrosis. These are gliding joint, like cervical joint, thoracic joints. Then we have glamorous joint. These are basically